That's what the actual section is. Oh, I got it all.
Yeah, it was unfortunate for a day. Okay. Such a bad accident.
Right?
So like,
I was
just gonna get out of the way. For that long one.
Okay,
I started, it's like in.
Yeah, I haven't like so then she's the best teacher. Okay, so when I had.
I know.
I'd rather take. I'm gonna get rid of my. He's really. I guess I'm thinking.
I told you a schedule today.
Okay, so I'm taking. You're taking? Bio. I've won at the end of the week. Everyone does alongside the hours, yeah. I had a semester one, my division on, it's like, oh. In like freshman year. No, you can't do that. They go, the other questions like, why is everything on the table really? Oh, okay, that's good. Something and then they just go, oh, how did I identify type? And like, okay, come back. I don't know.
Trust me, I think I know what it's like. I was like, I didn't know my symptoms. Yeah, I know that. My baby. Come here.
Yeah, I was totally pointing. It was like, I could even. Yeah. So I had a, like, I made and like laid out my schedule. And then my research, all he does is immediately. I have no way. I want. I would ask about.
I think one of my best friends might start.
If you look at there's some regrade thing, but I can. Error of it. I never think I go over these like sense or whatever. It's like I'm taking it on my own and selling.
Can I start presentation? Okay, good afternoon, everyone. My name is Chanho, second year as a PhD student in Animal and Dairy Science Department, and I'm studying swine nutrition with Dr. Zhang. I majorly focused on swine nutrition like vitamin D, medium chain fatty acid, or iron. So I'm not really good at microbiology and immunology. But I do my best to try today to give you some meaningful information today. Today, the topic of the presentation is about the effects of vitamin D in immunology and my previous study of vitamin D. What is vitamin D? Vitamin D is one of fast soluble vitamins that exists in two main forms. The first is vitamin D2, which is called ergocardiol. It's derived from plants and fungi. Next is vitamin D3, which is the cholecalciferol. And this can be synthesized in the skin upon ultraviolet light exposure and found in animal resources. The activation of this vitamin D is closely related with skin, liver, and kidney. First is skin. When people or animal get ultraviolet light, 7-dehydrocholesterol converted into free vitamin D3. Next is in the liver, is free vitamin D3 converts into 25-hydroxy vitamin D3, which is the primary circulating form of vitamin D3. Then it goes to kidney to convert into 125-dihydroxy vitamin D3, which is the active form of vitamin. This is the figure of the metabolism of vitamin D. So there are two major ways to get vitamin D in your body. First is skin by ultraviolet light exposure, and second is diet, like fish, or egg. So when this vitamin enters the metabolic cycle of your body, it must go into the liver and convert it into 25-hydroxy vitamin D. Then it can go to kidney to convert into 125-hydroxy vitamin D3, which is the active form of vitamin D. Then they can go to small intestine and bone to regulate the calcium and phosphorus homeostasis. Then why is vitamin D is important in immunology? Vitamin D is traditionally known for bone metabolism because it can regulate calcium and phosphorus homeostasis. But recently, many research focus its role as a key regulator of the immune system. They found out that vitamin D interact with the vitamin D receptor, which is present in various immune cells. Therefore, this vitamin D can play a crucial role in pathogen defense and immune modulation, impacting both innate and adaptive immune system. So this is kind of brief figure of how vitamin D can act on immune cells in your body. So vitamin D plays a crucial role in regulating immune system activity, both innate and adaptive immune systems. The innate immune system is responsible for the initial defensive front with a central role played by phagocytes. So vitamin D stimulates the expansion of these phagocytes, including monocytes and macrophages, and increasing their ability to fight off the virus by increasing their numbers, as well as increasing their killing capacity through stimulating the production of antiviral and antimicrobial protein like cathelicidin. Vitamin D also acts to regulate the maturation of dendritic cells, which are important for activating CD4 T cells and in turn the rest of the immune responses. And also vitamin D is a potent regulator of both cell-mediated T cell and humoral, which is B cell immunity. So this is a vital part of the body's defense against pathogenic invader, allowing white blood cells to recognize, bind to, and destroy pathogens, a process that relies on vitamin D to function properly. So first, vitamin D receptor is expressed in various immune cells, including macrophage, dendritic cells, and monocytes. These cells actively respond to vitamin D signaling, influencing immune function. Then, vitamin D enhances antimicrobial peptide production. It stimulates the production of cathelicidin, also known as LL37, and beta defense. These peptides have direct antimicrobial effects, making them essential for fighting pathogens like Mycobacterium tuberculosis and other intracellular bacteria. Finally, vitamin D helps in modulating inflammatory responses. It reduces excessive inflammation by downregulating key pro-inflammatory cytokines such as TNF alpha, interleukin 6, and interleukin 1 beta. This regulation prevents unnecessary immune activation and helps maintain immunity. Overall, vitamin D is a crucial modulator of the immune system, enhancing defense mechanism while preventing excessive inflammation. So I want to go deep with the pro-inflammatory cytokines and vitamin D. Pro-inflammatory cytokines are proteins that play a crucial role in triggering and sustaining inflammation in your body. So among them, I'm going to talk about interleukin-2 and interleukin-6 today. Interleukin-2 is not strictly pro-inflammatory cytokines, but excessive interleukin-2 can lead to immune overexpression. And also interleukin-6 is one of pro-inflammatory cytokine, and it stimulates the production of white blood cells and promote inflammation. There is one study conducted to find out the effects of high-dose vitamin D in nursery pigs under porcine rotavirus challenged condition. So the vitamin D requirement level is around 200 to 220 IU per kilogram. So they try to compare the requirement level of vitamin D3 supplementation and high-dose vitamin D3 supplementation, which is 5,000 IU per kilogram. And as you can see in this figure, when there was no, As you can see in this figure, when there was no challenge under porcine rotavirus, there was no difference between treatments. And as you can see here, under rotavirus challenged condition, high-dose vitamin D3 supplementation decreased interleukin-2 and interleukin-6 concentration in the blood, which is the pro-inflammatory cytokines. So by this study, you can say that vitamin D3 supplementation can improve immune function of the body. And also vitamin D is closely related with T cell regulation, B cell function, and immune balancing effect. First, for T cells, it inhibits T helper 1 and 17 responses, which means it reduces pro-inflammatory cytokines like interferon gamma and interleukin 17. At the same time, it helps increase regulatory T cells, which promote immune balance, immune tolerance, and prevent excessive immune activation. For B cells, it directly affects their growth and functions, reducing the production of autoantibodies, which is important in autoimmune disease. Overall, this mechanism helps balance the immune system by controlling both pro-inflammatory cytokines and anti-inflammatory responses. So this reduces the risk of chronic inflammation and autoimmune disorders, keeping the immune system stable and healthy. So T cell activation is a key step in the immune response. First, an antigen-presenting cell, such as the dendritic cell, captures an antigen and presents it to a naive T cell using MHC molecules. Second, the T helper receptor on the T cell recognizes the antigen MHC complex, and at the same time, a co-stimulatory signal is required to fully activate the T cell. Once activated, the T cells start to proliferate and differentiate into different types, such as T helper 1, 2, 17, or T regulatory cells, depending on the cytokines environment. So these activated T cells then help fight infections, regulate immune response, or maintain immune tolerance. So without this sufficient vitamin D, these T cells are unable to become activated, and the immune system is more likely to become dysregulated, leading to increased inflammation and decreased efficiency of recovery. So vitamin D deficiency can occur due to several reasons. First, limited sunlight exposure is a major cause. Modern lifestyles keep people indoors for long hours, and excessive sunscreen use blocks ultraviolet light exposure needed for vitamin D production. In addition, seasonal variation in high latitude regions reduce sunlight exposure, leading to lower vitamin D synthesis. Second, dietary insufficiency can contribute to deficiency. There are only a few natural food sources on vitamin D, mainly fatty fish, egg yolks, and fortified food. If the diet like this, vitamin D levels may drop. Lastly, certain health conditions affect vitamin D metabolism. Chronic kidney or liver disease can impair vitamin D activation. making it less available for the body. Also, obesity can cause vitamin D to be stored in fat tissue, reducing its bioavailability. Overall, these factors can lead to vitamin D deficiency, impacting bone health and immune function. So this vitamin D plays a crucial role in immune system, and its deficiency can have serious consequences like it increases susceptibility to infections, because low vitamin D levels are linked to a higher risk of respiratory infections, including influenza and pneumonia. This is because vitamin D is essential for producing antimicrobial peptides, which help the body fight off pathogens. When these peptides are reduced, the body's innate immune defense is weakened. Second, vitamin D deficiency can contribute to chronic inflammation and autoimmune disorders. Without sufficient vitamin D, inflammatory response can become uncontrolled, increasing the risk of autoimmune disease. Studies have linked with vitamin D deficiency to conditions such as multiple sclerosis, rheumatoid arthritis, and inflammatory bowel disease. Overall, maintaining adequate vitamin D levels is essential for a strong immune system and balanced immune response. So I conducted vitamin D and 25-hydroxyvitamin D in nursery pig study and conducting SAO right now. So I just want to introduce about my study briefly. So as I mentioned, when vitamin D enters the metabolic cycle in the body, it must be converted into 25-hydroxyvitamin D3 in the liver, which is the circulating form of vitamin D3. So this 25-hydroxyvitamin D3 can skip a step that vitamin D3 should undergo, and it has lower dependence on bile acid and chylomicrons. So it can allow them to directly absorb into portal vein because of its polarity. So it is well known that 25-hydroxyvitamin D3 is more bioavailable than vitamin D. So we hypothesized that vitamin D3 and 25-hydroxyvitamin D3 can reduce weaning stress of nursery pigs. So we wanted to test whether this 25-hydroxyvitamin D3 supplementation is more bioavailable than vitamin D3 supplementation. So we supplemented vitamin D3 and 25-hydroxyvitamin D3 at the same level. And also, if this 25-hydroxyvitamin D3 is more bioavailable, what will happen if we supplement equal half dose of vitamin D3 and 25-hydroxyvitamin D3 in the diet, which is 1,000 IU per kilogram for each vitamin D source. So we tested this 3 dietary treatment in growth, antioxidant status, and in immunity. The first is the result of plasma 25-hydroxyvitamin D3 levels. As you can see in the table, 25-hydroxyvitamin D3 supplementation increased plasma 25-hydroxyvitamin D3 levels, which is the circulating form of vitamin D3. This is because if we directly supplement 25-hydroxyvitamin D3 in the diet, it doesn't need to go into the liver to convert it into 25-hydroxyvitamin D3. So these 2 dietary treatments showed the greater value compared to the vitamin D3 supplementation groups. And also treatment 2, which contains equal amounts of vitamin D3 and 25-hydroxyvitamin D3, showed the intermediate values among treatments, which means 1,000 IU per kilogram of 25-hydroxyvitamin D3 supplementation may have lower bioavailability than 2,000 IU per kilogram of 25-hydroxyvitamin D3 supplementation. And then we analyzed antioxidant status in this study, and there was no difference among treatment in superoxide dismutase content and total antioxidant capacity, which is the antioxidant enzyme that can reduce the oxidative stress in your body. However, we were able to find some difference among treatment in malondialdehyde content. This is because vitamin D supplementation can induce methylocyanine synthesis, which can scavenge the reactive oxygen species in your body. And once your reactive oxygen species in your body decrease, that means your body doesn't get that high oxidative stress. So in this result, we can assume that 25-hydroxyvitamin D3 supplementation was more effective than vitamin D3 in reducing oxidative stress in the body. However, there was no difference among treatment in immunoglobulin A and immunoglobulin G concentration, which means 25-hydroxyvitamin D3 supplementation didn't improve immune function of nursery pig in this study. However, we can assume that this study was not conducted under challenging conditions, and as you know, our research facility is kind of clean, has more clean environment than commercial farm. So we are planning to do LPS challenging condition study to find out whether this vitamin D3 and 25-hydroxyvitamin D3 supplementation have beneficial effects on immune function or not. So other nutrients that supports immune health. So omega-3 fatty acid, vitamin A, vitamin C, vitamin E, zinc, selenium can help immune health of pigs and people. But not all of them have beneficial effects. So nutrition is kind of complex. So when one nutrient are supplemented at high levels, it can negatively affect the other nutrient utilization. So it is important to make a balance among the nutrients when you do nutrient study. So here are the key takeaways. So vitamin D is more important than just a bone health nutrient. It plays a crucial role in innate and adaptive immunity. So deficiency is linked to a higher infection risk, chronic inflammation, and autoimmune disease. The supplementation and adequate sunlight exposures are essential for maintaining immune balance. So future research will help optimize vitamin D-based intervention for immune health and disease prevention. Thank you for your attention, and I'll be happy to answer if you have any questions. Thank you. That's good.
As for a precursor, I am Stephanie Jacob. I am a first-year master's student under Dr. Calloway, Dr. Gilderstein, a combination. I did my undergraduate degree at Berry College, where I majored in chemistry and animal science, like a concentration in like pre-vet, pre-professional. And I decided to do this project on, are vaccines safe and effective, or are they harmful? And as a precursor, I want to preference that I am not an anti-vaxxer. My dad is a researcher. My mom actually works in the medical field. So my family does believe in the power of science. I am just trying to make a case that there is risk associated with all medical procedures. And that there is a great divide in the vaccine debate. Those doctors, researchers, healthcare professionals saying that vaccines are safe and effective. And then we have some people who believe that vaccines are more harmful than the disease that its targets prevent. And obviously from this, there are conspiracy theories like the government using chemtrails and or vaccines to make people like docile and obey them. I don't know what that is. It's really like a contrail, which is when water vapor from jet engines, freezes and condensates, and that leaves these trails. But people think it's chemtrails that like rain down and make people obey the government. You're not missing much if you don't know about that. And then obviously vaccines, they believe that like they track you and all that jazz. So conspiracy theories. In most cases, vaccines are safe and effective and prevent or reduce the disease is intended for. However, in some rare cases, and this is what anti-vaxxers really harp on and focus on, it can cause great harm to the vaccine recipients. Some of these effects come from the vaccine itself. So for example, if I got a shot and then I'm surprised I'm allergic to eggs, that's coming from the vaccine itself. And I'll give you more examples in that in a second. But more often, and probably what you all experience more of is that it's from the response to the vaccine. And a little bit of history, we learned about yellow fever. The vaccine made tropical life a lot safer. It was considered one of the safest vaccines. However, recently, there are some risk factors identified. Meningoencephalitis, which is swelling of the brain and the spinal cord, if you don't know. It's one of the complications from yellow fever vaccine, especially from older. And Martin Gore, who is one of UK's leading cancer scientists, died at the age of 67 in 2019. And obviously all deaths are tragic, but deaths like this specifically who try to contribute to finding a cure to something that kills so many people is especially tragic. Some more history. Once again, we learned a lot about smallpox, how it was very scary and deadly. The effective and safe disease eliminated this disease mostly. In some rare cases, however, some people got like the mild version of smallpox from the vaccinia virus that was used. And some people did lead to inflammation of the brain. And these two statistics are straight from CDC, which is between 14 and 52 people out of every 1 million vaccinated for the first time experienced potentially life-threatening reactions. But of that, there's only 1 to 2 that died from this, so it's very rare. So here's to come that everything in life is a risk versus benefit balance. Obviously, risking doing poorly on exam the next day because you had a good time out with friends, driving, flying, even just walking out of your house at this point is a risk versus benefit. In the case of yellow fever, however, the benefit of the vaccine may be higher in regions where yellow fever isn't endemic. The oral polio vaccine has some risk of getting, VAPP, which is basically when the virus mutates in you and that can cause a form of paralysis. And these two obviously are forms of when the vaccine causes more, itself causes the harm, not the response to it. So those are 2 examples of that. However, obviously there are some vaccines where the benefits are better than the potential risks. So obviously influenza have very few risks, and then the benefits are much higher. So childhood risks. The controversy revolves around giving so many vaccines to a newborn in such a short period of time and whether or not they can create antibodies for each infection when it is given in that short period of time. And obviously, we learned that mercury was used and now aluminum. And obviously are both considered harmful. However, the amount used is so small that it is unlikely to cause any issues, according to medical professionals, but obviously this cannot be easily addressed. And then although there are a lot of studies on the effectiveness of individual vaccines, critics complain that there are not enough studies on the safety and effectiveness of them used together and given at the same time. Which brings me to my fun point that, not that anybody's keeping track, but on January 15th at roughly 22 minutes and 48 seconds into class, Callaway was willing to fight anybody who believes that vaccines cause autism. And not that anybody's keeping track. I would obviously lose at any argument against him in this field, so I do not want to fight him then, but I am here to put up a fight and play devil's advocate, because why not? So obviously, as mainstream science denies any link between vaccines and autism, there are so many reports about personal stories in social media. And obviously, as we've learned, is that vaccines are obviously milder versions or inactivated, or like the COVID vaccine being mRNA. So technically, they're not supposed to cause a disease. They're supposed to just get an immune response. So with that, in general, there is really no direct link between vaccines and autism and other adverse conditions. But it is possible that an indirect link exists that medical professionals and maybe Dr. Callaway is not openly admitting. And I guess before I continue, I will address this throughout the rest of the presentation, but just to be clear, if this is true, this should not and does not lead to why you should be hesitant on vaccines, which I will cover throughout the PowerPoint. I just want to make it very clear right now. So the indirect connection is that many diseases cause swelling of the brain. In fact, any viral or bacterial infection can cause encephalitis, which is swelling of the brain. And I know, autism is very hard because there's no set cause. There's research. Is it environmental? Is it, genetics? Is it like the parents were too old, when the child was conceived, et cetera? But recently, there is growing evidence that brain swelling can cause autism disorder, given the inflammation can injure certain parts of the brain. So childhood diseases could be a cause of autism based on this information. And here are a few studies of that from various years. So now the main question is, can and do vaccines cause autism? Well, as it turns out, vaccines can cause brain inflammation in some cases. And these two are from, actually, they're both from 2023. I cut out the year apparently, my bad. But these are from the COVID-19 vaccination. This one here is actually about, I don't remember if it was a mom or dad, but basically they were talking about how their son was completely healthy, had, superior language skills. And then after receiving the MMR vaccine, which is measles, mumps, and rubella, if you don't know, he was diagnosed with autism. And now this was a whole thread that goes on forever, but the first thread afterwards was saying obviously correlation does not cause causation, which is true. But if this was caused by it, this little boy here was one of the 1 out of 1 million cases where encephalitis was caused by the MMR vaccine. And then right here, obviously, this talks about the risk versus benefit that I already talked about, but I want to point out here that the risk of encephalitis from contracting measles is 1 out of 1,000. So it compares the 1 out of 1 million with the vaccine versus 1 out of 1,000 for the actual disease, which brings me to my point here. For the actual infection and vaccine has the potential to cause brain swelling. This side effect can result in damage, including the potential development of autism. In general, the actual infection is much more intense than the reaction from a vaccine. Thus, the probability of brain swelling is much higher with the actual infection than from the vaccine. However, there is still the small chance that vaccine can actually cause brain swelling, resulting potentially in autism. Now, obviously, many who become anti-vaxxers give stories of their children suggesting their behavior was changed soon after the vaccine. Some report that children had high fever and was less active, like the behavioral changes, obviously. And these may be symptoms of some degree of brain swelling. Some of these children can actually may end up with autism. Once again, don't know because autism is a very complicated topic. And this is just prefacing again, no medical intervention is risk-free. There is a small risk associated with all vaccines. So what should be done? Just know the risk of vaccines. Unfortunately, doctors often don't give much information. They give the vaccine and send I said the baby here, but even for you guys today, you should know the risk of the vaccines that you're getting. When one gets sick, you look for symptoms, you drive the patient to the hospital, you drive yourself to the hospital. But when people assume that vaccines are safe, people don't pay that same attention as in the real infection. So looking for symptoms, and this is where the big mistake occurs when people assume that vaccines are safe. So watch for any unusual behavior after vaccination, just like with an actual infection. If something does not look or seem right, get skilled medical advice so that swelling can be controlled. I don't want to say it's easy because that makes it sound like it's not a severe issue, but it is very easy to control brain swelling early on, like steroids can take care of it. So it is an easy thing to fix if caught early. So in summary, instead of saying that vaccines are 100% safe and effective, we should say that most often they are safe and effective. But list the risk factors and ask parents to look for any adverse behavior. And this is especially true for, once again, when newborns get a lot of vaccines at once. Even, I remember I was 12, I got 2 vaccines in one arm, 2 in the other. I don't remember what it was, but so there's that. Also tell families that vaccines are much safer than getting the actual infection, since both can cause inflammation and therefore potentially autism. And this is just talking about you as an individual. This is not even talking about the benefits of the whole herd immunity idea about protecting the susceptible and are not and all that jazz. This is for once just focusing on you as an individual and a disease. And continuing on with the summaries, Of course, vaccines themselves, I do not want to say that you are injecting the chances of getting autism. That is not what I'm saying. But vaccines themselves do not cause autism, but in some cases, the inflammation resulting from the immune response from a vaccine may cause brain inflammation that could be a cause or contributor to the result of autism. But the actual infection could cause an even stronger immune response that can also result in autism. And so I guess my big takeaway, which is this is one of them, vaccines are safe in most cases, but not all. However, vaccines are very safe if we get proper treatments if adverse symptoms occur. And my biggest takeaway, I mean, not once again, just a summary of what I've talked about. Risk versus benefit analysis, benefits of vaccines significantly outweigh the risk. And then fine print is watch for the symptoms after vaccination and get medical help if symptoms imply brain swelling. This includes, fever, seizures, even like the silent seizures that some people have, behavioral changes, throwing up, just look for symptoms like that. And there are more sources about this. And once again, it's still growing. But this is the sources for brain swelling that may cause autism disorder. And then this is the vaccines and brain swelling correlation. So those two, and once again, there's more, but these are the ones that I found used. And then that's all I have. So. I apparently flew with that. What you did.